This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Today, we're talking about mental health, the challenges people face, the stigma that can make it harder to ask for help, and the resources that can make a difference. The 988 Suicide and Crisis Lifeline operates across the entire United States and allows people free emotional support via text or phone. It launched in 2022, replacing a 10-digit phone number. And since then, crisis call volume increased in Connecticut alone by nearly 350%. A recent study found that 988 may have helped reduce suicide deaths among young people. Joining us now, one of the researchers on this study is Dr. Bapu Jene, who's the professor at Harvard Medical School and a physician at Massachusetts General Hospital. Dr. Jene, welcome to Where We Live.
Thank you for having me.
So, for listeners who may not be familiar with the study or with the hotline, can you walk us through what you set up to investigate and why you want to examine the impact of this hotline, the 988 Suicide and Crisis Lifeline?
Kat, let me start by saying that I hope no listeners are familiar with the study, because if they read it, they've got they've got other things to worry about. So this was a study with two other colleagues, Michael Liu and Vishal Patel, both at Brigham and Women's Hospital in Boston. And what we were trying to do is figure out what was the effect of 988 on suicide deaths. And basically what we did is we looked at data from 1999 all the way up until 2024, and we tried to project what suicide deaths would have looked like following July 2022 had 988 not been implemented. And what we essentially see is that there would have been roughly 39,000 deaths, but it was 35,000 because of 988. So a reduction of about 4,000 suicide deaths nationally. That's about 11% reduction. Most of the gains that we see were among adolescents and young adults, which makes sense because those are heavier users of 988. You don't see much happening for older adults, which sort of made sense. And the other interesting finding is that if we look at states where uptake of 988 was the largest, meaning there's a larger increase in call volume from July 2022 all the way until December 2024, those states with the largest increase in call volume were the ones where you saw the largest reductions in suicide deaths. So this was sort of an empirical study trying to quantify what a lot of people have said about the program, is that it's helpful.
And why did your team focus specifically on young people? And why do you think that they're the demographic that would be using this more?
Two reasons. One is if you think about mental health issues and suicides in particular, which is the extreme form of that, they are larger in adolescents and young adults for a variety of different reasons. So that was the first reason to focus on this group. And the second group is we know from the data empirically that group is much more likely to use 988 than older adults. That might be familiarity with technology. That might be a willingness to reach out to someone who you don't know for help. So there may be cultural things. There may be sort of comfort with technology. Any of those things could explain it. But we know it's a fact that young people are more likely to use the service than older people.
And so we love seeing data on this team for sure. But can you help us contextualize what those numbers mean? You know, how meaningful was that reduction? And just to give a bit more background, put it in another way, what do these findings tell us about the potential impact of having a readily accessible crisis line?
I mean, I think they're enormous. And I work as a medical doctor. There's very few things in medicine that if we implement them are able to reduce mortality. A lot of what we do improves the quality of life, but a lot of what we do can't improve the length of life or quantity of life. Here's an example where an intervention we think corresponded to almost an 11% reduction in suicides, something around the order of 4,300 suicides nationally. To me, that's an enormous amount. If you think about how much effort and resources went into implementing the program, cost more than $1 billion to set up the lifeline, to increase crisis line capacity, train workforce, all of those things. If you try to put the sort of the economic value to society of the lives that we gained, the impacts that those lives have, not only those people, but on their family and loved ones, it's gonna dramatically sort of outweigh the costs. So from a sort of public health or public policy perspective, it's sort of a no-brainer.
When you mentioned that the 9A Lifeline is available nationwide, were you looking at data from across the country or were there sort of differences between state to state?
Great question. So both. So we were looking at data from across the country, but we are particularly interested in looking at what I would think of as sort of high uptake states versus low uptake states. So if you look at states, let's say the top 10 states in terms of uptake, those states had more than almost 150% increase in monthly calls. If you look at states in the bottom 10 in terms of uptake of 988, they had roughly a 25% increase. So all states saw an increase in monthly calls to 988. But there are some states where it was almost 5, 6 times as much. And in those states, we saw larger reductions in suicides. So just to give you some numbers, in those top 10 states where calls increased dramatically, 18% reduction in suicides, just larger than what we saw on the average nationally.
Well, and based on the numbers you just shared, do you see or are there any qualitative factors, things like trust or accessibility or even the quality of interactions with counselors that may play an important role but are harder to measure?
I think those are probably very important. What we don't know a lot about, and it would be, I think, both important and fascinating to study, is how much does it matter who picks up the phone when someone calls, right? There's going to be sort of people who are going to be very good at comforting someone who's calling. And there's going to be a match element too, because not everybody who calls in is going to have the same personality, the same willingness to share what's going on. But they may have a match with a particular person. So if we could better understand, what are the qualities and characteristics of those counselors who pick up the phone that make them particularly good at what they're doing? Are there ways that we could establish better matches between who is calling and who picks up the phone? Those are all sort of important public health and clinical questions, but there's also a data-driven element to that. Could we use data to try to figure out some of those answers? That's where someone like me, I think, has a particular interest.
Well, and of course, we're going to be diving into more of how exactly what you mentioned in terms of how conversations can help change a life or how personalities when humans are talking to humans, how that can impact everyone's stories. I'm curious to hear, based on your research, was there anything that surprised you? Of course, it's good news, obviously, that there you see a reduction. Were you surprised that people were using the lifeline?
I wasn't surprised that people were using the lifeline. I think what I was more surprised by, and I think the jury is probably still out on this, is what is the magnitude of the effect of that sort of interaction between a caller and someone who's picking up the phone on the lifeline. An 11% reduction, 4,000 deaths attributable to 988 is a large number. And I think some could say it's implausibly large. Like, do we think that a program like this could have that much of an effect? I think it has to have an effect. How large it is hard to know. And so that magnitude feels surprising to me. But at the same time, I don't really have a benchmark to base it off of, right? Like, this is not something that we're able to study at large scale very easily. And for something like this, I think moments matter. So if you're calling in a particular moment where you are sensitive and someone is able to help you, it's not strange to think that could matter in terms of the decisions that you make about your life.
And I imagine there are challenges working on this study because there are certain things, as you mentioned earlier, that it can't really be quantified or measured. But are there any plans to follow up?
I think there's two things that we're interested in. One is to try to get a better sense of the qualitative elements of this, which I think are interesting. And the other is we're trying to think of ways that we could establish more rigorously whether or not this effect is there. So for instance, one strategy might be to look at situations where there are cell phone blackouts or disruptions. And the theory would be that on those days, if someone is contemplating suicide and they call in or they try to call in, they'd be unsuccessful in doing so. So what do we see on days like that? If we see an increase in suicides on those days in the post-988 period, but nothing happening in the pre-988 period on sort of days where cell phone access is limited, that would be more convincing, I think, sort of data-driven evidence that this program has an effect. So we're thinking about those kinds of questions.
Well, we're looking forward to learning more about answers to the next questions that you're going to be asking following up the research. But before we end this conversation, how did the research, how did you going through this process, did it change how you view how these services work or just how this environment is like for people? Did it change how you thought about it at all?
Yeah, absolutely. And if you think about a government has to make so many different decisions that impact the health of the people who live in a state or a county or a country. Here is one of those decisions. It took years for this to happen, and you could say, well, could it have happened earlier? There's also intentional policies that matter. So, for example, for certain populations like LGBTQ, that there was a specialized service, part of 988, that was eliminated. Now there's discussion of bringing that back. You have some evidence like this that suggests this program might be helpful. That sort of pushes you in the direction of saying, all right, from a policy perspective, maybe we should bring it back.
You've been listening to Dr. Bapu Jaina, who is the Joseph P. Newhouse Professor of Healthcare Policy at Harvard Medical School. He's also a physician in the Department of Medicine at Mass General Hospital. Dr. Jaina, thank you so much for being on the show today.
Thank you. Thank you.
After the break, we'll talk about how Connecticut is working to address mental health challenges, reduce stigma, and connect people with support before they reach a crisis point. This is Where We Live. Stay with us. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. We've just heard about research suggesting that the 988 Suicide and Crisis Lifeline is making a difference for young people. And now we're turning to what mental health support looks like here in Connecticut and why advocates say reducing stigma is just as important as expanding services. Joining us now, State Representative Kai Belton of Middletown. Representative Belton, so good to have you on.
Thank you so much for having me to be a part of this important conversation.
We're excited for having you join us. And Jackie Davis, Director of Learning and Workforce Development at Mental Health Connecticut. Jackie, appreciate you being here as well.
Thank you for having me.
So, Representative Belton, I'm going to start with you here. You were listening to the conversation earlier. What's your reaction to this research that's showing 988 may be helping save lives among young people?
I mean, this is really great information, and thank you, Dr. Jenna, for that information. So I think one of the things that stood out to me first and foremost was the billion-dollar investment, over $1 billion he talked about. And I feel like we often wonder if investments and decisions that we make in mental health actually make a difference. And this is evidence that they do. When someone is in crisis and having an easy number to remember, that can literally save a life. And I think that that's what Dr. Jenna spoke of. And 988 gives people this immediate access to support during some of the darkest times of their lives. And the fact that we're seeing reductions in suicide among adolescents and young adults is incredibly encouraging.
So this is according to the CDC. Here in the U.S., suicide remains a leading cause of death among adolescents and young adults. And Dr. Jenna mentioned earlier that the research that he did could help provide information when it comes to policy work. Now, what role can state policy play in addressing this reality?
No, I think what we can do is have more mental health resources and education in our schools. We need more access to counselors and therapists, and that means improvement in the workforce. That means increasing reimbursement rates for therapists and counselors. And we need to help young people develop these coping skills, emotional regulation, and resilience, and also recognizing the impact of social media, isolation, trauma, violence, racism. And I think one of the things that we don't talk about enough anymore are the impacts of COVID on our young people. And I do just want to mention that Connecticut, we have a state mandated task force called the Transforming Children's Behavioral Health Policy and Planning Committee. And this is a 51 member committee. And I like to say that there are many experts in the room, and they have a strategic focus on, there's a strategic plan that is being executed. And this really focuses on improving system transparency, accountability, and cross-agency data sharing, specialized facility planning, crisis service studies, community engagement, and workforce. So I'm proud that Connecticut, is making these critical steps in improving our system. We should definitely be investing more money, and we should be moving faster.
So it sounds like there's a lot of movement happening here in Connecticut. And Jackie, as part of that action, tell us more about Mental Health Connecticut's Let's Face It campaign. What inspired it and what are you hoping to accomplish with it?
Yeah, so Let's Face It was started in 2022, right along with 988 coming out. No reason why it was the same year, just kind of came to be. We used to do what we called 31 Days of Wellness for Mental Health Awareness Month every May, and decided that we needed to elevate what we're doing, not just have the resources and the articles and the information, but actually tell people stories. And we do the play on words of Let's Face It by actually showcasing the faces of our neighbors here in Connecticut, letting them tell their stories, amplifying that so they can have that stage and that platform to say, I'm a human being. And some days are not so great days, and that's okay. And I think we need to share these stories more often to destigmatize mental health and mental health conditions, because there's a lot of misinformation out there. And so the Let's Face It campaign showcases our neighbors across the state throughout the entire month, and going hand in hand with those resources of how can I also get help, because now I have this role model in my life that I'm learning about that literally is one town over from me. So it's really powerful to hear those stories, and we've been going strong every year since then.
I want to talk more about those human-to-human interfacing and how the impacts do have a positive experience for people who need to hear it, or not need to, not realizing that they did, right? But I want to throw out a quick stat here, because 1 in 5 adults lives with a mental health condition, and roughly half of Americans still experience one at some point in their lives. So being in the space that you're in, Jackie, are people surprised when they hear those numbers or when they hear people share stories about their struggles?
Yeah, generally I do see there are some people that are still surprised by those statistics, because I think people start to personalize it of like, oh, 1 in 2. When is it going to come? When's the shoe going to drop? And they start to get anxious about just thinking, well, could it happen to me? I didn't think it would happen. I'm immune. That's somebody else's problem. And that's where that stigma kind of lives, of thinking that you're not part of what the possibility is. And we like to just showcase that we're all human beings. So by nature, we're all susceptible to emotions and feelings, and all of these things happening to us are completely natural. And what we try to do is provide the resources so people can navigate and personalize their own mental health journey so that they can be at their best.
Representative Belton, we've been talking a lot about statistics and data, and many people still struggle to talk openly about mental health, and sort of building on what Jackie just shared here. Why do you think the stigma still persists?
I think there are a variety of things, right? There is culture, there is, social media, people feeling um, like, this is something shameful. And, I think it's important for the Let's Face It campaign and other initiatives like that, to show that, people are human. It doesn't matter if you are, a state representative who is also a social worker. You are also human, and, you could absolutely be facing some mental health struggles. And that's why it was important for me to do the Let's Face It campaign. When I was asked, I was honored to do that.
Well, and Jackie, there are so many reasons and elements, whether or not someone is comfortable with sharing their own stories and their own journeys. Are there any gender gaps or racial gaps or any sort of gaps about what is acceptable, air quotes around acceptable for people to talk about? And what are some first steps that we can address the problem?
Yeah, there definitely are some of those barriers when it comes to gender, when it comes to race, any of our identifiers. It really just comes down to culture. As Representative said, that there are those barriers that come up just by how we were raised. It's also generational as well. Some individuals feel that they've reached a certain point where I can just get over it, I'm fine. And those attitudes can come up and those behaviors kind of shift your mindset of what you think could possibly burst your bubble. You think like you're at a certain level where like, no, I'm fine. I can get over it. I've done this before, and you build up your own resiliency, and then you forget that you can still ask for help. So we like to have those reminders. But yeah, those do definitely come up quite often. And for our perspective at Mental Health Connecticut, we have a person-centered approach to our care, whether that's our services, our advocacy, or our education. And I'm on the community education side as the Director of Learning and Workforce Development. So I go out into the community to talk about these things, to ask people to have these conversations in the workplace, in their community, at their local library, and create safe spaces for people to just come and be themselves, possibly get some resources, get some help. I brought some 988 magnets with me today to share with everyone. I always have a pack in my purse, making sure those resources are readily available. I think that's the best thing we can do, is to just bring the materials where we go, meet people where they are, and just create space for those conversations to take place.
And what are those conversations like? And of course, there's no typical conversation. Such case by case, everyone has a different story. Do you find people who are very willing to share immediately, or are they a little resistant for a moment and it takes some time for them to warm up? What are the conversations like for you when you're in the community?
Yeah, you're 100% right. Every conversation is different. Some people are completely an open book. They wear their heart on their sleeve. I'm one of those people. But there's other folks that they feel, that shame that we talked about. They are somehow embarrassed by what they're going through, or maybe they don't even have a name for it yet. They just think something's off and they can't put it into words. So the conversations usually start with questions. For whoever that person is. If I'm in the room with someone, I'll come from the standpoint as an educator. I'm also a mental health first aid instructor. So I know how to navigate those conversations, assessing what's going on, listening without judgment, being able to encourage as opposed to giving advice to somebody, and just really being there to say, how are you doing? No, really, how are you doing? My uncle was amazing at doing that all the time. He'd never take fine for an answer. He always dug a little bit deeper. So I take that legacy forward and always just make sure, like, it's okay to say you're not doing okay. And if you're not and you want to try to get a little bit better, I'm here for that. I can connect you to something, or I can just continue to listen to you. We can go take a walk. Like, what do you want to do? Make it personal. And the conversation just kind of goes from there.
Well, Representative Belton, can you talk about how you became involved with the Let's Face It campaign, and why is this issue personally important to you?
Yeah, so I think this campaign came out of my partnership with Mental Health Connecticut up at the legislature. I am a newer legislator, and I came into the legislature because a loss of a friend, Representative Quentin Williams, and now I hold his seat in the 100th district. So when I first got elected, it was a special election, so a lot of legislation and committees were like already in the works. So here I am trying to find my space, my place, and grieving at the same time, and also feeling such heaviness all around me in the legislature because there were so many people who were also struggling. I would come to work and people would see me and just cry. So you can imagine how that must feel as, someone who is trying to step up for her community, already heavy with grief, walking into a space that is grieving, not being able to contribute. So I said, okay, what can I do? It was May was coming, and I was like, mental health awareness, that is something that I know. And Mental Health Connecticut was a great partner, and that got this fair up and going, and it's been successful. We just did year number 4, but also as the vice chair of public health, Mental Health Connecticut is a great partner in our state legislature and in keeping us grounded in what's happening on the ground.
Well, and it sounds like that was a very difficult and challenging transition into your role. Challenging already anyway, but the circumstances, I imagine, made it even more so. And did it become clear that your social work background and your sort of awareness of the benefits of having conversations was going to help you as a representative at that point?
Absolutely. Absolutely. I feel like being a social worker in the legislature is definitely an asset to this role. We have 2 other social workers, no, sorry, 3. And I feel like, the skills that we have benefit all of the things that we do up at the legislature. And this fair, in collaboration with Mental Health Connecticut, was important for the public to know the resources, but also for the individuals who work in that building every single day, who deal with heaviness of making decisions for the state. We have advocates who come to us with the most horrible stories, and they want their lives to change. And we have our own family stuff and the things that we're already carrying to the legislature. So this was an opportunity to give them some care and connection, as well as to have resources for people in our communities.
So, Jackie, Representative Belton talking about sort of the policy level at the state, and you work extensively in the community on the ground as well. And want to go back to what we were talking about earlier in terms of people hearing each other's stories and how that can impact them. What happens when people do hear stories from others who've experienced maybe similar challenges, or maybe just stories about themselves that help them realize that, oh, I'm not alone?
I think it's very personal, so I can only speak to what I've witnessed.
Of course.
I know for myself, hearing other people's stories, especially the people here in this room that you're going to hear from, as well as our representative being part of the campaign, it reminds me of humanity, how we can be at our best and our worst and still thrive. Even if you're having a horrible day, you can still get through it. And there's a phrase that I always cling to is you've lived through 100% of your worst days because you're still here telling your story. And I'm paraphrasing that, but I feel that that's what echoes when I hear stories from other people of that they've seen tragedy, they're going through grief, they're struggling, but they're still here. And that's so inspiring to me that everyone can find their own unique path to get through it. And I think even if I've never had the same situation, if I've never been in that person's shoes, I'm still a human being and I can empathize with what's going on. And that same resiliency that we build, it has a healing factor to know that I'm not alone, as you said, that I can also get through it and I can find and carve my own path as well. So it's just very inspirational. And I hope that people feel that when they read these stories as well.
Well, before we get into the next segment, as you mentioned, we are going to be hearing from 2 people who are featured in the Let's Face It campaign. What do you hope people keep in mind about mental health after hearing this conversation today?
I hope that people hear when we talk about mental health that they're automatically not going to mental illness, that they're not always thinking about what could be perceived as a negative or a struggle or a challenge, that mental health is just like our physical health. And when we talk about going to the gym to take care of our bodies, we're talking about sleeping, getting good nutrients, drinking water. That's how we take care of our bodies. We need to think about how we're taking care of our minds as well, how we're thinking about regulating our emotions, knowing how to cope, how to navigate difficult conversations. All of these things are skills that we can work on, we can practice, we can do good and give back to ourselves. So I hope that people know that mental health is just as important as our physical health. It's something that we can tap into every moment of every day if we give it that consideration, and that hopefully they feel empowered to take better care of themselves.
When Representative Belton, for someone listening right now who may be struggling, but they don't know where to turn or how to start that conversation, what resources would you want them to know about?
I would definitely want them to know about 988. Like, that is extremely important. I was also a mobile crisis social worker for youth, and I've answered many of those calls. I love that we have a 3-digit number. I think that helps so much. And, if you are struggling, if you just want to have a conversation, if you have questions, that is a number that you can call to just connect with someone, because vulnerability creates connection and connection creates healing. And that's where you start.
You've been listening to State Representative Kai Belton of Middletown. Representative Belton, thank you so much for sharing your story today. You're also listening to Jackie Davis, who's the Director of Learning and Workforce Development at Mental Health Connecticut. Jackie, I appreciate your time as well.
Thank you.
If you or someone you know is in crisis, please call, text, or chat with the Suicide and Crisis Lifeline at 988. And after the break, we'll hear from 2 Connecticut residents who have navigated their own mental health journeys and talk about why sharing those experiences can help others feel less alone. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. This hour, we've talked about mental health through the lens of research, policy, and public awareness. Now, we're turning to the personal. Joining us are Connecticut residents Rob Santos and Rachael Perillo, who have both spoken publicly about their own mental health journeys through Mental Health Connecticut's Let's Face It campaign. Rob, thanks so much for being here.
Hey, what's good?
And Rachael, appreciate you being here as well.
Thank you.
So loving the fist bump that you did earlier. So that already tells our listeners that we have a camaraderie happening. And both of you have been listening to the conversation throughout the hour. What stood out to you, Rachael?
I think for me, it's a lot of what Jackie and Representative Belton talked about, which is helping people to talk out loud about just mental health in general. I think mental health has a stigma of being negative, and it's not. It doesn't have to be. I think that the more that we can share our stories and the more that we can all provide resources and help for other people is so important for everybody's success and everybody's awareness, but also just that support aspect and well-being overall.
And Rob, did you ever expect to be talking about mental health in public?
Oh, yeah. Yeah. To go off what Rachel was saying, like that question you just asked, right? I was bothered the whole time because I have so many, like, not necessarily arguments, but viewpoints on it. And for me, it's all about what are my emotions telling me? Our emotions and our feelings are straight up tools, in my opinion. So me being bothered is a point of creativity, and me being bothered is an opportunity for me to be present. So to hear all the things that everyone's saying, like, to me, the language around mental health, I feel, is the real issue. So, but I love, just love the connection overall.
Well, what are some of the things that was bothering you that you would like to sort of unpack or build on as we're having this conversation?
Everything, but in a good way though. Like, for instance, the stop the stigma. I can't stand that. The stigma behind the stigma is wild now. Because now that language is what prohibits people from doing the thing. Rachel, you made a choice to do what you did, right? Mm-hmm. It's like, Jackie, you make a choice to get out there and do what you do. We all make choices. My thing is, can we build a certain skill set for people to get past those feelings and those emotions to make a choice?
When I did want to talk about the role language plays. Earlier we talked about conversations, opening those conversations and allowing people to realize that there are safe spaces out there for people to share their stories. But language, of course, matters. And I think we've kind of gone through different eras of talking about mental health. I was just having a conversation with a friend recently, just over the weekend, that if you told us 10 years ago or 5 years ago that you will meet a new friend and you start talking about mental health within the first minute, you'd be like, that's not really something that happens. But it does happen today. I don't know about you guys, but it does happen to me in both a personal and professional space. So, Rachael, that's a long-winded way of asking you kind of what Rob was mentioning earlier too. You know, how important is it to sort of, as we continue to have these conversations, as these conversations happen more, how do you think language will start evolving, or has it evolved?
I think it's a great question. And also to your point, Rob, I also hate that break the stigma, let's break the stigma. It's old. It's getting like painting this picture that it is something that's still negative, so we need to get over it. I think mental health just needs to be a natural part of life because it is. And it's almost just like culture in the workplace. It needs to be a natural evolution. It needs to just evolve. And I do think that over time it has been more and more. For me, I talk openly all the time. I love airing my dirty laundry. And it is kind of like, if I'm going to meet somebody, I'm always personal first and foremost, because I'm like, where can we make that connection? And if it does have something to do with mental health, that's great. Because if I can share something about me or they can share something about them that is important, it's impactful, it matters, it will help anybody else along the way, whether it's directly or indirectly, and we can share our stories all along. So again, it just becomes normal and natural flow and not something that has to necessarily be its own topic or subject anymore.
And Rob, what about you? Can you talk about your own journey and how you got here today?
Oh man, see, I came up in the dark ages of mental health where like there wasn't any of this information, where the number was the 1-800 number, right? Mm-hmm. And you know, trying to get a psychiatrist or trying to get a therapist, and during that time was just extremely difficult. And on top of that, you know, I'm a beige dude, as I like to say. I'm a Black and Puerto Rican guy coming up in like New Britain or Hartford or living in New York. And saying any of that stuff out loud was just odd. And then eventually I made a TV show called Beige. I got to a point where like you see a certain story. So instead of like black guy getting out of jail, I made a show about a beige dude getting out of a mental institution, right? What does that journey look like? And the amount of black men that hit me up and saying, yo, I've been there. I see that. I've been through that. And then on top of that, those same individuals were the ones who were making fun of me. Mm-hmm. So it was extremely difficult during that time, especially feeling like I was alone on that. So overall, like I got here because I don't know how to give up. I just have this iron will. And when my daughter decided to show up, my daughter Brooklyn, you know, now she gives me an opportunity to impart my wisdom on her, even though I'm not going to be here forever. But as long as I know that I can take what I've learned, my each one teach one mentality, and put it on to her, then I know that my legacy and my wisdom lives on despite what I experienced.
When I want to talk about the role humor plays in helping you navigate those difficult periods of your life, but I do want to talk to that because you've spoken openly about growing up in New Britain and experiencing loneliness and what you just shared now. Mm-hmm. And of course, later receiving an ADHD diagnosis. Looking back now, what do you understand today that you didn't understand then?
That calling myself a psycho or a functioning psycho or a crazy person was not the way to go. I don't even use that language anymore unless I'm doing it on stage. Understanding that whatever you feed the brain, right? Just like that's the mental health portion. Just understanding that concept changed so much. But then when I snapped at the funny bone, I was on stage and I was doing my old set, and I can feel my girlfriend like look at me because some of the old jokes I was doing wasn't hitting. I wasn't feeling them. And then I just snapped and said, is anybody in this room crazy? And that look on everyone's face changed the trajectory of how I see myself, how I view my on-stage work, and then using my emotions as an opportunity to embrace who I am, just like the way Richard Pryor did. So that's what changed everything, the language, and also dialectical behavioral therapy, DBT.
Well, talking about language earlier, right? And it sounds like you're both doing this on stage and off stage. So what role does humor play in helping you doing all that?
Oh, man, like Rachel's dope.
I let me crawl out of my car this morning.
Was hilarious. She's about to dive out to push that button. I'm like, oh no, hope she's okay. But then her hair caught me, right? See, that's humor. Because I will look at her and I would have slight fear for her because she's the type of person, she seems like someone's put together. She knows what she wants. And I'm like, oh my God, I know nothing, right? And that would put a little bit of fear in me. But then having this understanding of knowing what my emotions are, it's just like, no, I don't fear for her. My emotions are telling me that I respect her. And when she sent me an email over the weekend, or prior to the weekend, it made me feel so pretty, you know? And I was like, oh, wow, I like this woman just based off of her vibe. So for me, like, humor is just what I presented now, and also satire, you know, it's just who we are. Just humor is the ultimate universal language. You don't have to speak English to know what humor is. And it breaks everything down.
Well, and Rachel, what Rob just shared here, how does that resonate with you, especially since you had your own journey and now you're here with Rob having a conversation on the radio? Did you ever think this moment was going to happen?
No, and I'm so excited. I'm so happy that we're able to do this all together. And it's funny because something that Rob said definitely resonates with me and strikes me. A couple things. The word crazy, I use that in my story in the Let's Face It campaign. People are like, don't worry, you're not crazy. I'm like, I know. But also, we're all crazy, to your point. The other thing is how you just said, Rob, like, he saw me in the parking lot this morning, said I looked put together, you know, wouldn't maybe know that I'm here for this today.
Sure.
And I think that that's important for people to understand, too, is mental health doesn't come out always in the physical sense. And so we have to look at people for exactly what they are, humans, which is on the inside. And I think that's, like, again, if we use the word stigma, which I don't like to all the time, but I think historically people have looked at mental health and said, oh, this person struggles for mental health basing on physical alone. And you've got people walking around, high-level executives that look all together, all buttoned up, makeup pretty, kids, white fence, and they're not.
Well, and then I think there's a theme here too, especially like talking about mental health as physical health, like the way we say, oh, your arm's broken. We see the physical health component, but you don't see the mental part of it. And there's an invisibility to it that I feel like we're still breaking here. And Rachel, you've struggled with postpartum phase of your life. I'm wondering, what role does the community or friends or family, loved ones have played in your own journey towards healing? You know, even being around people like during the show today.
Yes. And again, I can't say it enough, talking about it, and just having people who are listening, they don't have to give advice, but just to be able to hear and to acknowledge and recognize, okay, I can talk about this. This is not something bad. And I think from a community standpoint, work is important. We spend so much time of our lives at work. I think having like a very good support system, even through professional relationships, is something that I'm very lucky to have. We have required training where I work at One Digital that is around psychological safety, which I love. I think that's awesome for us. And we talk a lot about authenticity. And I think for me, a big place of community besides my family, my friends, is the gym. And I was never somebody to go to the gym. I'm like, couldn't even run the mile in high school. That was me. I joined Orange Theory a couple years ago. And the funny part about it is I don't go there to talk and have like the social community aspect of it. It's just the feeling. So the feeling of community, people surrounded me who are there for the same reasons, whether it's physical, mental, social benefits of being in a place all together, working on yourself, even if I go and don't talk to anybody that day. So I think community is very important and can mean different things to different people.
Listen, I can barely make it to my mailbox. So what you just mentioned makes me feel like I need to do a little bit more. And I wanted to get to Rob in a little bit, talking about how you both got involved with Let's Face It. But Rachel, did you have a defining moment where you realized that it's okay to talk about this?
I think after my postpartum, more and more people were starting to share their own stories of postpartum on Instagram, social media. So we talk about social media. It's the best. It's also the worst. I think for sharing stories, it can be great, especially if they are authentic and are helping other people. For me personally, the Let's Face It campaign, I shared on Instagram during the month of May, and the responses that I got back from people I haven't talked to in years, sharing their story back, thanking me for sharing mine. And I think, too, once I went through my most recent mental health type of crisis was when I was induced with menopause last year at the age of 39 following several surgeries that I had to have. And that's when I was really like, I got to talk about this. And there are medical professionals there to help, but it's hard to find. So you've got to like speak your story to everybody until someone's like, hey, I know someone. Let me connect you. So that's why it's so important.
And Rob, how did you get involved with Let's Face It?
Oh man, Bethany hit me up, but it's odd. Like so,
Introduce Bethany for us.
So Bethany, she works for Mental Health Connecticut. And Christina, they came through. So I did a show called ADHD Me, and we did it over at the Warner Theater. We taped it. They came through, and we had access to their information, and so that was a working relationship that I had with them. I can't recall how it got started. I probably just hit them up, and then that's how it kept going. But to go to like the point of real quickly about how you mentioned the physical aspect of it, I do a joke or a story where I talk about how because I live with ADHD, borderline personality disorder, and all that, and then I do a story about how I was jealous of my girlfriend when she had cancer because everyone knew how to love her with her physical element versus me with my mental one. And one of the punchlines is, I watch everybody go and love her, right? They're running 5K, they're baking cookies. Like, I want cookies, right? And then I saw the way they would go love her, and I said to myself, man, I want cancer so bad. That's the punch, because that's the kind of love I'm willing to die for. So when I think about, like, those kind of jokes, those ideas, my show Beige, all those things, I hit them up. They were like, oh, okay, we see what you're doing. And then that conversation and that our relationships just started to grow.
So when you work those jokes in, very mental health centric, into your comedy, do audience members tell you that they were surprised to hear you share those stories, or did it feel like they resonated, or is it a mix of the two?
Oh, it's a mix. I want to scare people. I don't want nobody coming to my show safe. You want to go, you like, don't do that. Like when I work with kids, I have kids, tell me what you hate, tell me what you love. And when they can identify those emotions, it makes it easy. So for me, when they come to my show, they see like, oh, wow, this guy's honest. You guys were just mentioning about the stories you're sharing, right? And people, what they're saying to you. No one tells me I'm funny anymore. Everyone just tells me what they experienced. So when I do those kind of jokes, or I do a joke about my daughter being a superhero princess, and, and she was 5 years old when she did that inspired me, they resonate because they come from a real place.
Well, we love a superhero princess. So any day here, she has our support. We got about 2 minutes, so I want to make sure we get through some more questions, because clearly we can go on for a long time. Rachael, as we kind of progress with the conversations and with more and more people hopefully being more comfortable in sharing their stories, what do you wish people understand more about living with mental health challenges?
I wish people understood more how isolating and lonely it can feel. I think having people around you, having a good support system, having community shows up on the outside. But again, it's what's going on the inside. And you can have all of that love, you can have all of that support, but you can still feel very alone. And I think that that's the part that is hard to explain to people unless you've gone through something like that.
Mm. Well, and Rob, a lot of what you're talking to, it's funny, but it's not funny, but it's also funny at the same time. Right. What do you hope people are talking about more when it comes to mental health challenges?
Oh, man, I don't know. I really don't, because my whole thing is just like, what is your mental education? Can you understand the dialectics? Can you understand that more than one thing can beat you at the same time? Can you understand that just because you feel this way doesn't mean you need to behave that way? What is your emotional mind? What is your rational mind like? I would love for the conversation to continue to be that way.
We got about 45 seconds. I would love for Rob and Rachael to leave a last thought for each other. Rachael, what would you like to tell Rob?
Oh, word.
I would like to tell Rob, thank you for bringing humor into such a serious topic, but making it be easier for people to swallow and be able to not feel so alone.
Yeah, I would say that, one, I really appreciate the small talk we had, because I told you how I feel about small talk. But,
we both hate it.
Yeah, but I'm grateful for the story you shared, because like I told you about my mom, so I'm grateful for you. So I appreciate you.
Thank you.
Well, thank you both for being so honest with us and for sharing your stories. You've been listening to Rob Santos and Rachael Perillo. Thank you both so much for being here and sharing your stories. And for our listeners, if you or someone you know is experiencing a mental health crisis, you can call or text 988, the Suicide and Crisis Lifeline. It's free and offers confidential support 24 hours a day. You can also find resources for Mental Health Connecticut and other organizations on our website at ctpublic.org. I'm Catherine Shen. Today's show is produced by Chloe Wynn. Our technical producer is Dylan Reyes. Download Where We Live anytime on your favorite podcast app. Thank you all so much for listening, and take care of yourselves, everyone.